Now, do we have any questions from our studio audience? The woman in the back with the gray.
I want to thank you all for giving this great information. It's answering a lot of my questions.
Great.
But my question is, my father had terrible varicose veins that he had stripped many years ago. Is that the best way to treat my bulging varicose veins?
You know, I'm really glad that you asked that. And we all know that for many years, vein stripping was the best thing that we had to offer. But that's no longer the case. Mel, would you like to talk about that question?
Yes. Vein stripping was offered at a time when many of the new technologies that we have today were just not available. Now we have devices that can treat the same problem that we did surgically through a small puncture, almost like an IV puncture, and we can insert a small catheter that will thermally, using heat, to ablate that vein instead of just removing it. And there are other techniques also very new, and they're constantly evolving. This technology is constantly moving forward, and the goal of the technology is to reduce the amount of discomfort for the patient, increase the speed with which they recover, and give them an excellent cosmetic and medical result.
I think one of the big advances really has been ultrasound. Would you agree?
Oh, absolutely.
One of the problems with vein stripping is it was really done blindly. We thought that we knew what was beneath the skin surface, but it turns out that everybody's veins are a little bit different. And with ultrasound, now we are a lot more powerful, aren't we? Nick, what do you think about that?
Yeah, I tell patients that ultrasound machines are nothing more than computers. And just like all other computers over the last 10 to 20 years, they have advanced tremendously. So the quality and the amount of information that we get that allows us to treat patients in a real targeted way, in a very minimally invasive way, is much better than it used to be.
I have a lot of patients who say, who had vein stripping, and they say, if I knew then what I know now, I would never have that done again. What do you think, Steve?
You know, Helene, I think that I think that's true, that people who know about vein stripping don't want it, but I get the other question, which is, isn't vein stripping going to be better for me in the long run? Won't I have better long-term results? And I think the somewhat surprising answer to that is probably no, that's not the case. Even though it's a more aggressive, invasive procedure, these minimally invasive techniques not only are easier to recover from, less risk, less expense, but there probably is as good or better long-term results.
So these treatments are a lot easier to go through.
Yeah, much easier. I take great joy in watching patients walk out of the office following a procedure that formerly would have put them in the hospital for a few days and at bed rest for 6 weeks and all sorts of difficult recoveries, and that's just all gone.